gosh, that didn't hurt at all.
Yeah, I was going to say.
Okay.
Hey, I recognize that lady.
Yeah. 1 in 4 women dies of cardiovascular disease. It is important to know about heart disease to be able to help prevent and protect your heart from damage. I'm a cardiac sonographer and see many different types and levels of heart disease daily. In this speech, you will learn about the signs and symptoms, diagnosis and tests, and finally treatment and prevention of heart disease in women. Heart attack symptoms in women are often very different from men. The most common heart attack symptom in women is some type of pain, discomfort, or pressure in the chest. However, in women, this pain is not always prominent. Women are more likely to have heart attack in symptoms such as neck, jaw, shoulder, or upper back pain, says Mayo Clinic staff who wrote Heart Disease in Women, Signs and Symptoms, published in 2015. Other symptoms include shortness of breath, pain in one or both arms, nausea or vomiting, sweating, dizziness, or unusual fatigue. Often women seek medical attention after heart damage has already occurred because their symptoms are not usually those associated with a heart attack. Now that we have gone over the signs and symptoms of a heart attack in women, let's move to diagnosis and test. Evaluation of a possible heart attack is determined by many different tests. An EKG measures the electrical activity of the heart. An EKG can often reveal evidence of a previous heart attack or one that is in progress. An echocardiogram provides images of the structure and function of the heart, the strength of the heart muscle, size of the chambers, function of the valves, pressure inside the heart, and the likelihood that the heart muscle has been damaged can be assessed from an echo. A nuclear imaging stress test is performed to see the blood flow through the arteries that feed the heart under stress. This imaging is recommended for women as they tend to be more asymptomatic at rest and develop symptoms under stress. Cardiac catheterization is the most accurate way to diagnose coronary artery disease. A small catheter is threaded through an artery in the leg that leads up to the heart. Dye is then released through the catheter to help determine any blockage in the arteries that feed blood to the heart muscle. Lab tests can also be performed to measure cardiac enzyme levels. If these levels are abnormal in the blood, it can help cardiologists make the correct diagnosis of a possible heart attack. Now, let's finally go over the treatment and prevention of heart disease. Treatment and prevention of heart disease go hand in hand. The first step in treatment and prevention of heart disease is lifestyle changes. These changes include eating a low-fat and low-sodium diet, exercising regularly, quitting smoking, controlling your blood pressure, controlling diabetes, maintaining a healthy weight, and managing your stress. The second step is to start on medications. Medications can help to both treat and prevent further heart disease. These medications will depend on the type of heart disease, and your doctor will talk with you about the correct medical treatment plan. Common medications that your doctor may start you on are cholesterol-modifying medications to keep your cholesterol in the normal ranges, aspirin to help reduce the tendency of your blood to clot, beta blockers to decrease your blood pressure, or nitroglycerin, which can help control chest pain, says Mayo Clinic staff who wrote Coronary Artery Disease, published in 2017. Medical procedures or surgery are the last option for treatment. A heart cath procedure, as mentioned previously, is able to diagnose the amount of blockage in an artery. If a significant amount of blockage is found, a cardiologist is able to place a stent to open up the artery during heart cath. If an artery is completely blocked or they are unable to safely place a stent in an artery, the next step is open heart surgery. During open heart surgery, they will bypass the diseased vessel with a healthy vessel that will be able to restore blood flow to the area of your heart that is affected. In conclusion, you have learned of the signs and symptoms, diagnosis and tests, and finally prevention and treatment of heart disease in women. Heart disease is the leading cause of death in women in the United States. Stay active and present in knowing about your own health care. Know the signs and symptoms of heart disease and avoid being just another statistic.
Wow, that's it.